Westside United Impact Investing represents a strong collaborative and one of the strongest social impact investments on the West Side.
It's important for institutions to invest in Westside communities because for decades, those communities have been disinvested. People have not come to those communities. Businesses have not built their businesses in those communities. And it's vital that communities have an opportunity to grow, to find jobs, to create wealth for the people who live in those communities, because all of that is really very important to health.
Many of us know that the difference in life expectancy between a household, a family on the West Side, and that same household or family in Streeterville, for example, can be 10 years. The members of Westside United and CDFIs like my own are working together to reduce that gap in life expectancy to improve the social determinants of health on the West Side.
Impact investing is an opportunity for our institutional partners, such as the American Medical Association, our founding hospital partners, and the Illinois Medical District, to reallocate their existing resources towards community projects. In short, it's low-interest loans to increase economic opportunity.
AMA's big vision for health equity is aligned with Westside United's vision because we know that we have to be close to the people in the community if we're going to stand a chance to create a program that can be really successful. You've got to be on the ground, you've got to listen, you've got to understand what the issues are in order to solve this problem.
Impact investing is really about a philosophy. It's when a foundation, a corporation, government, or an individual makes a decision on an investment that is really driven by the social benefit or the environmental benefit that they anticipate, as opposed to focusing more narrowly on that traditional profit or market rate return.
These loans support a wide range of community investments, from education to affordable housing, small business supports, and construction for community projects.
We are so grateful for the support of Westside United and the IFF in our organization because we were able to get access to low-interest loans to be able to fund our project and our renovation for the purchase of our building in North Lawndale area of Chicago.
Westside United's anchor partners for impact investing include the Illinois Medical District, the American Medical Association, Northern Trust, and our founding hospitals, Rush University Medical Center, Lurie Children's Hospital, Cook County Health, UI Health, Sinai Chicago, and Ascension. Westside United partners with 4 community development financial institutions who have a complementary and holistic approach to impact investing. LISC Chicago lends to and supports community agency through quality of life planning processes. The Chicago Community Loan Fund offers technical assistance to support borrowers in addition to increased access to capital. Allies for Community Business provides individual supports for small businesses, and IFF finances nonprofits' capital projects.
The impact investing that Westside United is doing through CDFIs is already changing the landscape of affordable housing, job creation, homeownership on the West Side.
I have a passion for affordable housing. I have a passion for youth homelessness, and I like to fix up distressed properties. I like to provide affordable housing for people who typically couldn't afford market value housing. It's really a great opportunity for organizations like mine to have access to low interest loans, specifically because I do most of my work in inner city. So having access to that allows me to do projects that I probably typically wouldn't be able to afford to do.
Having access to low interest loans is one of the greatest blessings that a nonprofit could have.
The investments that the AMA is making in Westside United, along with many others, are different than previous investments because they're targeted, because we're understanding the root problems in these communities and learning from the communities themselves before we make the investments.
I just feel like we all have this gift and we all have these things that we love to do to help people to move forward. And when I'm able to do that and it makes a difference, it's even better.